Future doctors, welcome to Pocket MBBS, where medicine fits in your pockets. Now let's study today's topic, that is cervical cancer. Cervical cancer is the most common gynecological malignancy in the world. It occurs in 4th and 6th decade of life in a female, and its etiological factors are human papillomavirus and environmental factors. Classification of cervical cancer are squamous cell carcinoma and adenocarcinoma. Now, in gross, there is three pattern seen in cervical cancer. That is fungating or exophytic pattern, which is the most common pattern and in which the tumor appears like a cauliflower. Then second feature is ulcerating pattern and third is infiltrating pattern. Cervical carcinoma arises from squamocolumnar junction. Now, in advanced stages, we see infiltration to the adjacent structure, that is in urinary bladder, rectum, vagina and regional lymph nodes. And in distant metastasis, we see the spread of tumor into the lungs, liver, bone marrow and kidney. Now we will study squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma is most common, it is 70%, and adenocarcinoma is less common and it occurs 20 to 25%. Squamous cell carcinoma arises from squamous columnar junction. Adenocarcinoma arises from endocervix. Squamous cell carcinoma contain non-keratinizing large cell. Adenocarcinoma contain mucin secreting cells. Squamous cell carcinoma is arranged in sheets and hyperchromatic nuclei and high INC ratio is seen, whereas adenocarcinoma is arranged in glandular pattern and glands are formed in adenocarcinoma. Now in the figure we can see the fungating cauliflower-like growth of the tumor. Clinical features of cervical cancers are in which the patient has postcoital bleeding after sexual intercourse, persistent vaginal discharge which is watery or blood-stained discharge, pelvic or lower abdominal pain is present, dyspareunia present means pain during the intercourse is present. For diagnosing the condition, we will do a screening test of Pap Smear by the exfoliative cytologic method, in which the Pap Smear is a screening test used to detect abnormal cells on the cervix that could lead to cervical cancer, for which the sample is collected by exfoliative shedding or scraping of the cells of the cervix. Now the procedure of Pap Smear is: lie the patient in lithotomy position, insert speculum into the vagina, take sample of cervical cells using soft brush and spatula. Scrapped cells are then examined under a microscope to check for the disease or other problems. It helps to detect precancerous and cancerous cells and also help to see the cervical changes. Possible results are normal, no abnormality seen, or abnormal in which the cell changes detected but not necessarily means cancer. And here is the histological diagram of invasive cell cancer of cervix, in which we see the non-keratinizing tumor cells, then the mitotic figures and inflammatory cells, that is lymphocytes. That's all for today's videos. Thank you. Follow for more such videos and do like, share and subscribe to my channel.